Why? Because it increases confidence in decision making, and also it keeps practice current and relevant and updated. Okay, we agree that evidence-based practice is necessary. We should have it. We should do it. Is there any barriers? Yes, we need barriers. We have barriers, of course. Some institutions do not encourage evidence-based research. Some institutions do not even provide magazines or ways for nurses to go and look at the updated reports. And also, besides this, I said that nurses are so tired and busy in their work to the point that they don't have time to go into this and go and find research articles. These are the main barriers. It is also the difficulty in making change. Change is always a problem. And also, because there is no time on the job to read research. Now, in conclusion, nursing research utilization is not enough to close the gap between the evidence-based practice and research and the practice that we have. We have research, we have research utilization, we have experience, we have values, and all of this. So it's hard for us to do this unless we mix this together. And they're telling me 3 minutes. I have, before I go and leave the stage, to tell you about my recipe that for evidence-based practice that shows you the best one. You can write it down or at least remember it. What you need for my recipe is a blender, a big blender. And be sure that blender is good because this blender is you. And in this blender, we have to add 2 parts of nursing utilization. 1 part of personal experience, 1 part of clinical judgment, and 1 part of values, and 1 part of patient's preference. Now you use the blender and mix them together. Now before you use evidence-based practice, 2 things I want to warn you from. The first one, do not ever use black or white pepper people, because this will make evidence-based practice hard. What you have to do before you provide the evidence-based practice is maybe to use a little bit as play some of the spirit, nursing spirit and spirituality of the recipe. It is the recipe itself, and then provide it to your patient care. Thank you very much.
Thank you, Mr. Ismail. If I please said why and mentioned the word recipe, he reminded me of a story. It's a little joke. Now, a lady was invited to her friend's house and she was served a fish. It was really a delicious dish. So, she wanted to know the recipe. But the problem was she couldn't see the tail and she couldn't see the head. I think some of you heard this story. So she said, where did you learn this recipe? She said, from my mum. So let's go to your mum and just get the recipe. So they went to mum and said, we'd like to know the secret. Why do you cut the tail and why do you cut the head? So the thing is, let's go to our grandma. So the mum went to her mum as well. So they went to grandma's house. So when they went to grandma's house and said, we'd like to know the recipe and we'd like to know the reason of cutting the tail and the head. And the answer was, at that time, the pan was small. So the thing is, so this is why I think you ask yourself why, it's very important to get the answer. So I think Noor Ismail, or Noor, sorry about it. Yeah, Noor Hussein. Sorry again. Noor Hussein is our last guest speaker. And Noor Hussein, she's a specialist in human resource and quality management as well. So how to start an evidence-based nursing practice? The first step, just tell us how to start. Of course you can. Oh, sorry, I need to give her. She's a lady.
Assalamu alaikum. Is my voice clear? So, good morning, everybody. It's very difficult for me to stand behind for 15 minutes, so I need to see you very well. Actually, if you will focus with me within the coming 15 minutes, I will guarantee that you will be able to start your Sunday with evidence-based practice. So I'll give you a very helpful tool in which you can start actually applying evidence-based into your practice. So I have only one very simple objective, which is actually to explain the steps of evidence-based practice. We have learned from the previous speakers is that we always have to ask why. So why are we talking today about evidence-based practice? There's an evidence that if we use evidence-based practice, then that leads into a lower cost, higher patient satisfaction, higher nurses satisfaction, and higher quality of care. So it looks to be a very good thing to implement at our clinical practice. So what is the tool or how we can go about doing this? Actually, the title is How to Close the Gap from Evidence to Action. So my speech is about how to actionate all the nice speeches that you will be listening for. So there is step 0, and then we go into step 6. Step 0 is that to have the curiosity to learn. You have the spirit to question why. To ask yourself, why I'm wearing the mask in the surgical unit or in the theater? Why I am doing this in that way, and so on and so forth. It says it's very easy to ask why when we have a new disease or a new syndrome. I had a case, pediatric patient, newborn, with Batrichium syndrome. It's very easy for me to ask, what is Batrichium syndrome? Why the child with this, and so on and so forth. However, it's very difficult and challenging to ask why should I wash my hands between and before and after every procedure. Because we don't usually question the routine-based nursing activities because we take them for granted. Well, evidence-based says that we have to ask why for new syndrome, new diseases, new treatments, as well as for these routine-based activities. So first, to have the curiosity to learn and to ask why. Because if we don't have this why, we will not go into the first step. I will be focusing on the first step, and the rest will be covered by other speakers, and they are actually self-explanatory. So the first step is to convert your curiosity and to convert the inquiry into something called PICO, which is the tool I will be teaching you about. PICO, it's a form of a question, a structured, systematic way of asking a clinical question. You put this question in your pocket. You don't have time because we work 12 hours. During your 4 days off, you collect some PICOs and you start searching if you have time. So this is the PICO that I will be explaining to you about. So it's a form of a clinical question. I have a question, and definitely I need to look for an answer. And then I need to go and search the literature for the best answer for my clinical query. We always need to appraise and critically analyze if that evidence is good enough or not, especially if it is non-research-based evidence. If it is research-based, again, we have to question, is it a duplicated research? What is the methodology? Is it randomized? What is the sample size? And so on and so forth when we talk about research. Again, don't take research for granted. There are certain elements that we need to critique research constructively, from the sample size, methodology, duration, and so on and so forth. I've reviewed the literature. I have analyzed and validated the evidence. I went and I applied the evidence. Don't forget the recipe that has been provided to you. Put some clinical judgment, address the patient value and preferences, and then go into the evidence-based practice. Evaluate the outcome, did it work or not, and then disseminate the evidence-based results. I wish I had more time to explain point number 6. Before going further, I would like to touch base on something. In general, we have two types of questions. We have too many questions all over the place, but we can categorize them into two types. The first type is a background question, and the second type is a foreground question. Background question is a question that is asking or inquiring about general information, general disease. The foreground question is asking about very specific phenomena or a disorder. The background question, which is the general question, usually it's addressed by the 5 whys and the husband. And what are the 5 whys? It's the when, the where, the what, and the why. And the how, the H is the how. So if you ask, what is this disease, why it happened, when and where and how, then you are still in the background question. The focus of today's speech is to ask about an evidence into a very specific clinical situation that you have faced at your clinical day. Then we need a tool. For the background, the tool is the 5 wives and the husband. And for the foreground question, the tool is PICO. So how to ask a very specific question in a structured and cerebral question. You know, most of the time, sometimes the researcher or the PhD, those who are doing PhD, it takes them years and months in order to identify, guess what, the question. So if we got the right question, then we definitely finish our PhD and we got the right answer very, very quickly. So what is PICO? P for the patient population of interest. Whom am I studying? What type of patient? What's their age? What's the illness? When it started? What's their family history? Know more about the patient. And then what is the intervention that I am interested in? And then, if applicable, is there any comparison between this group of patients and the others? Or is there any comparison between this type of treatment and this or the other type? And then what is the outcome and what is the time, again, if it is applicable? I am 100% sure that you do not understand anything about PICO. And you will never understand it unless we take an example. So I'm in a clinical day. The day is really very busy. And I got a very interesting scenario, which I don't have time to investigate now. So what are the elements that I will keep in my mind in order to remember this clinical question? P is the population. In hospitalized patients, are the use of hand sanitizer as effective as traditional hand washing in controlling infection? Here I'm questioning a very routine-based nursing activity that, as I mentioned, sometimes it's very difficult to ask yourself such a question because it's just very, very basic. So what's the population I'm interested in, what intervention, what type of comparisons and outcome? Again, you might not understand it very, very much quickly. The PICO is very effective in any scenario, whether you are looking to investigate an evidence with regard to diagnosis, therapy, prognosis, or etiology. So if we use PICO to build a structured and cerebral clinical question with regard to any of these items, you will succeed. Let's take an example. How the PICO can be effective when inquiring about a diagnosis. Let's take this. In patient with suspected pulmonary fibrosis, how does high-resolution CT compare with line biopsy for establishing the diagnosis? How can I use PICO? What is the P? P is for the population. What is the population here? Yes, it's patient with pulmonary fibrosis. What is the I? What is the intervention? that I am investigating and looking for evidence? Yes, it's the high resolution CT. What is the comparison? I am comparing the CT with the lung biopsy, so this is my comparison. And O, I am looking for sensitivity and specificity. I would like to know which one of these two modalities is more effective and efficient. So here I have utilized PICO. Now we are talking about transforming all these nice theories into actions. If we would like to go back with a tool, we can have something called PICO form. And I'm sure we have too many decision makers here in the hospitals. This PICO form includes nothing, just brief description of the tool and the 4 items. So when the nurse got any inquiry in her mind, she will pick one of these forms and write very quickly, patient with pulmonary fibrosis, high resolution, lung biopsy sensitivity. When she got the time, she will collect the PICOs and then start looking for evidence. Let's take an example of PICO effectiveness in etiology. Do obstetrical complications during pregnancy increase the likelihood of schizophrenia in the child? Very interesting. I don't know the answer. P, what is the population I'm looking for? Pregnant women. What type of intervention? Obstetrical complications. What comparison? No obstetrical complication. And what is the outcome? Childhood schizophrenia. So again, here I use the PICO. I focused on the 4 elements in order to start looking for a specific evidence. When it comes to therapy, again, PICO is effective. In patients with acute myocardial infarction, are antiarrhythmic drugs more effective than the standard therapy in preventing sudden cardiac death? So who is the population under study? I'm studying patients with MI. The intervention is antiarrhythmic drugs. The C is the standard therapy. I'm comparing the standard therapy, and O is the sudden cardiac death. So have you understood how can I use PICO to inquire about etiology, diagnosis, therapy, or even prognosis? So if we have these forms available in the wards, wherein the nurse can write quickly what comes to her mind in terms of inquiry, and then when she got the time, she can answer her inquiry. This is first, if we would like to talk about action. Have this form in the clinical setting where nurses can use it. This is first. Second, during your staff meetings, you consider or you can put PICO as one of the topics to be discussed. So how many PICOs do we have? Or maybe we have 5 PICOs. What was the clinical question? And after next meeting, you can share, or the person who is inquiring can share with the staff what are the evidence, what are the results, what are the research studies that they have read. The second thing is that we need always to manage and measure the effectiveness of the tools that we use. So we can have a key performance indicator under research. We know we have different performance indicators that we measure our performance against. We have clinical indicator, we have strategic, we have financial, we have clinical indicator, research and clinical indicator. Maybe underneath this KPI or this category of key performance indicator, we can number of search PICO, which means how many PICO did this word come up with, and versus how many people we did share and understand. Yes, I have 1 minute only. Okay. So this is how we can put this into action. We can have a form, we can discuss PICO in the staff meeting, and we can have a KPI for this. Similarly to prognosis, we can use PICO. Actually, as I mentioned, the next of the steps, they are self-explanatory. So in brief, PICO is a tool that helps nurses to ask a well-structured and formulated question. It's not easy, to ask a good and specific question, a smart question. This is actually a skill that all nurses need to develop with practice. So thank you very much, and I'll be happy to take any questions later on since we don't have much time. Thank you. Thanks for being here.
Please allow me to invite Dr. Jane Watson to join the discussion panel. Thank you, Dr. Watson.
Just to summarize, our guest speakers, Dr. Watson, she talked about caritas caring science, and then we got Ms. Mariam Kiffi. She talked about evidence-based practice, compatibility with nursing. Then the third talk was by Dr. Elizabeth Rideout, evidence-based nursing, what it is and how it's developed. The fourth talk was by Mr. Fayed Ismail, evidence-based nursing practice and research, are they the same? The final talk was by Ms. Noor Hussein, first step peacock in evidence-based nursing practice. So we just opened the discussion panel. So if anybody has got a question, we're ready. Yes, please.
First of all, my name is Yasmin Osman, DDT Medical Assistance. Okay, no, I don't think I need a mic. My voice is pretty loud. I've been a nurse since 1970-something, so I'm old school. I'd like to say thank you so much for the topics so far. Computerized therapist approach. Thank you very much.
My microphone doesn't seem to be working, but I guess it is now. Thank you for your wonderful contribution and suggestions here about this work, because we're all still caught up in this industrial model. And this is what has to be repatterned for healthcare. It's not working for anyone. It's not working for the system. It's not working for society. And so what's happening is we're going through transformation. However, when you and systems are starting to critique and use, it's not either or, it's both and. It's that blend, if you will, that we have. To me, the question is to pause and to critique the whole issue of evidence, because what counts as evidence has to be revisited, because we're still caught up in that empirical model of one form of evidence, and we don't want to restrict ourselves. And that's one of the contributions of this panel, is really addressing it beyond just one form of evidence. You cannot take a piece of evidence and inject it into a patient situation. It's too complex. However, I must say, in systems that are using this theory to guide their practice, total transformation is happening from the person to the system. And if I'd had time, I had multiple examples of how this is being translated into action, where nurses are taking responsibility to be much more directly accountable to the patients for this complexity of care, using this kind of consciousness to transform the way in which they are actually intervening with patients. And if you even go back to Nightingale, the reason we're here for this International Nursing Day, is she was very, very spiritual, but she developed the first pie graph of using evidence, using knowledge to make a change in terms of the way soldiers were treated in the Crimea. So it's not an either-or issue, but I think we have to go back to the human dimensions. We can't just work with a cognitive, rational model. And there's quite a bit of critique of the evidence from the social action research Peter Reason and some of the work out of England have actually said it's unethical to only use this one form of evidence, that we have to go to the people and use their own experiences in combination with these facts. And facts and meaning have to be mediated for this work.
Thank you, Dr. Watson. What do you think, Dr. Watson, about culture? I mean, does it have a role in the actual science of culture?
I'm sorry?
Culture. I mean,
culture.
Yeah, moving from one culture to another.
Absolutely. Well, the culture has to be a critical part of the meaning and the human dimensions of this work.